All right, Chrissy, thank you. If you think you might be too young to think about colon cancer, think again.
This is a new report came out from the American Cancer Society showing an increase of people under the age of 50 who are being diagnosed with this. Dr. Abby from Sharp-Sealy joining us now. Doctor, good morning.
Good morning.
It seems to me that the obvious question here is why? Why are more young people being diagnosed with this? Is it that more people are actually going to get checked?
So that's, of course, a very good question, and the answer is that we just don't know. We're not sure. There are a lot of theories, and one of them is possibly that more people are going in to get checked, but we also think that diet may play a role, and also the fact that people are more sedentary, because we know that's one of the risk factors for colon cancer. But we have seen a 9% increase in diagnosis in people 50 and under since 2020, and that's actually pretty significant.
I'm going to share this because I'm hoping that it will motivate people to go check and get screened. We have somebody in our family that 50 years old, diagnosed, and just finished her last chemo with colon cancer. There's no history of colon cancer in the family, and it really shook up our entire family, where I went and got a colonoscopy, and everybody's trying to figure out what's going on. The doctors I spoke to during the time that I was in chemo with her said that there are a lot more younger people that are being diagnosed with colon cancer right now.
Absolutely, we are seeing that, and I'm sorry to hear about it. I'm glad that she is on her way to recovering. But that is one of the myths associated with colon cancer, that if you're young, you don't have to think about it. And part of the reason why the guidelines have changed is because of this. So now the guidelines state that if someone is 45 and older, they should be screened for colon cancer.
Before it was 50, right?
Before it was 50.
Okay.
And because we started to see this increase, and you may not have a family history of it. So that's one of the things I hear. I don't have to get screened because I don't have a family history, and that's just not true.
And if I may say too, the screening of it, because by the time the colon cancer is usually detected and you have symptoms, that cancer has been growing for years inside. So that's why the screening is so important.
Exactly, yes. The screening is important because a lot of times when we see these symptoms, it may be that it's in a later stage, but one of the most common symptoms of colon cancer is no symptoms at all.
Wow.
And that's important. We may not see any symptoms.
That's scary. And so many different kinds of cancer out there, obviously, but this is one of the deadliest. So when you hear this and you get this diagnosis, obvious cause for concern. Treatments, I mean, are there different options? Are there experimental options, or what can we do?
So this is actually treatable. So we don't want anyone to panic because there are options for treatment. And even when you're getting your preventative colonoscopy, we're looking to see if there's polyps that we can take out before they become an issue. And so it's important to realize that colon cancer is treatable, it's preventable. There's things that we can do. You're not powerless to prevent it.
Right.
The colonoscopy is not one would think, the most pleasant experience. Some are very scared and they're fearful about what will happen. I can tell you, I did it just a few months ago, and it was actually, we joke about it was a great diet because it really flattens everything out on your tummy. It's not that scary. It's very quick.
Absolutely. I took my mom in to get this, and I'm sure she loves that I tell all my patients that I took her to get it done. And right after we went to go get fast food afterward to kind of celebrate. But really, it's not something that people remember. It's not something that's painful. A lot of people are very scared to get it done, and it's not a good idea to skip your screening just because of this.
Right.
But there's also other options for screening, so that's a
there
big
is,
thing.
besides
Yes.
the colonoscopy?
Absolutely.
Okay.
So there are other tests that we can do, stool tests that are actually very good screening, and so it's important to talk to your doctor about that as well.
When your daughter's a doctor, what do you expect, Mom, right? I mean, it's part of the, I know you made the joke about the fast food right after, but like the risk factors you were talking about, diet is a big deal. What can people do before they get this, or just in terms of change? Is it a lifestyle change that needs to happen in terms of diet, or what's the best recommendation?
Absolutely. People are always shocked when I tell them that there are risk factors that you can prevent, one of which is actually watching your diet for high-fat foods. So you want to avoid high-fat content foods. You want to avoid processed foods. So nothing against Oscar Mayer, but those lunch meats, not a good idea to do consistently. You may want to get an air fryer, put fresh food in there, and meal prep. All of those things are going to be important. And then alcohol, of course, limiting your alcohol significantly, avoid smoking, and being active. Try to be active, watch your weight, and lots of fruits and veggies. These are all things that are important.
I think in the messaging to people, sometimes it gets lost and you think, oh, no high fat, you can't do that, it's 100% eliminate everything. If you talk to your doctor, they can kind of give you parameters, right? Because you can have a little bit of this, a little bit of that, a fast food after you get your colonoscopy.
Exactly.
It's not a all or nothing, right?
Exactly. It's okay to indulge every once in a while, and you should. I don't think that you shouldn't do that every once in a while, but don't make it habitual.
Exactly.
And just remember that there are other options of foods that taste good but are also nutritious.
How I do my screenings around my birthday of February, it's where I do all the mammograms, I do the yearly checkup, and now with my age, colonoscopy has become one of them. So thank you for coming and reminding us.
That's
and I hope
amazing.
people will write it down and make that a thing that they need to do.
Absolutely. Absolutely. It's good to see you
And
both.
I think your mom is happy hearing that you're sharing her
We'll see.
She's setting a good
She'll
example,
watch this.
right?
We'll see.
Dr. Abby, thank you as
Thank
always.
you.
It's good to see
Appreciate
you.
it.